Hello, and welcome to another edition of Orthopedic Sports Medicine Patient Educational Series with Dr. Adam Derhake. In this video, we're going to address specifically some of the issues of returning to work following a labral repair of your shoulder. For this particular video, we're talking not about a labral tear that's associated with an acute shoulder dislocation, but rather a tear that has resulted from overuse injuries over time. These patients are often laborers, such as my construction workers or my assembly line workers. This video will explore some of the issues that you may encounter as you are attempting to return to work following your labral repair. Labral repairs that are performed on shoulders that did not have a history of instability or dislocation really are in a different category of their own, specifically when it comes to the goals for the rehab and some of the things that we're looking at in rehab in order to return patients from work. Oftentimes, chronic or degenerative tears of the labrum, as we had previously said, come more from overuse injuries over time. They're not necessarily from one trauma, although a single incident at work, such as I see in my workers' comp patient, can kind of tip the scales and cause the shoulder to go from asymptomatic to symptomatic. Oftentimes, degenerative tears of the labrum or acute tears of the labrum that occur at work that are not associated with a shoulder dislocation can also be associated with underlying osteoarthritis of the joint or damage to the cartilage on the surfaces of either the ball or the socket. Because these tears are not associated with a dislocation or a history of what we would determine as instability of the shoulder, we are typically simply debriding the labrum and or fixing the labrum back down to the bone, as you can see in the surgical animation video. However, we are not trying to plicate the capsule or trying to tighten up the shoulder. And so because of that, oftentimes the range of motion following a labral repair that is not associated with a stabilization procedure is able to be achieved a little quicker in the postoperative period. We have less restrictions about internal and external rotation stretches, and we are less worried about recurrent instability with our stretches. Because of that, we advance all of our initial postoperative stretches in a similar fashion regardless of the plane or the angle that we're placing the arm in. However, in order to return to work, patients must be able to regain all of the range of motion in their shoulder as well as all of the strength in the shoulder. During the first month after the procedure, you are in a sling with virtually no use of the arm. This is the same whether you are getting a labral repair because of instability episodes or a dislocation, or if you're getting a labral repair as a result of overuse or an injury at work. Either way, the tissue needs to heal back to the bone before we can start any range of motion or therapy exercises. During that initial period of immobilization, we expect that there will be some stiffness that will develop within the joint. There's also a certain amount of deconditioning within the muscles of the rotator cuff attached around the ball in the socket while you are not using the arm in the sling. Both of these consequences following a labral repair with subsequent immobilization require correction with formal outpatient physical therapy before it is safe for patients to go back to work without restriction. Initially, during the first month post-op, you can expect to be in the sling around the clock. I will allow people to return to work in the sling if their work will allow a restriction of absolute no use of that arm. Even if work does allow you to go back in your sling, I usually recommend that patients do not return to work within the first 2 weeks following the procedure, simply because of pain and being on your narcotic pain medication. While in the sling, I do not allow for patients to operate vehicles, nor do I allow them to return to work or drive if they're still on their narcotic pain medication. At 1 month following the surgery, I expect that the sling will be removed and you will begin passive range of motion and stretching exercises with the physical therapist. However, you are still not lifting anything with that arm. So even though you are out of your sling, in terms of work, you're really limited to just desk work only. So I will allow you, for example, to type with that arm, to run a mouse. However, I do not want you picking up or lifting anything with that arm. At 2 months post-op, you return to my office for reevaluation. I'm hoping and expecting at that time that you have regained all of your passive range of motion of the shoulder, not only in elevation, but also in rotation. At that time, we usually advance you into more active range of motion exercises, and we begin strengthening exercises of the shoulder. It is vitally important that we reestablish all of the strength in the shoulder, specifically the strength of the rotator cuff, as the rotator cuff is the primary dynamic stabilizer of the shoulder. As the muscles of the rotator cuff continue to become stronger and stronger following the procedure, they are able to better control the position of the ball relative to the socket. The end result of that is that the labral tissue itself and the glenohumeral joint, or your ball and socket itself, experiences significantly diminished forces with normal activities. Of course, the less force that you are placing on your labrum or on your labral repair, the less likely you are to re-injure yourself or have recurrent pain or symptoms. If you attempt to return to work prior to regaining all of the strength back into your shoulder, you significantly increase your risk for recurrent injury to your labrum, which could result in the need for repeat operation. Because of that, when you are able to return to work with no restrictions following a labral repair, oftentimes is multifactorial. It's based on the extent of the labral repair that was required, the amount of associated underlying arthritis of your shoulder, your progress with your physical therapy, and the amount of strength that you're able to regain in the shoulder, as well as the different types of activities that are going to be required at your job in order to return to your job without restrictions. In other words, if you work at a desk job, you will return to work with no restrictions at a much earlier time period than if you work as a laborer on a manufacturing line or as a construction worker. Ultimately, the decision of when to return to work following a labral repair of your shoulder is done on an individual basis, based on each individual patient's surgery, their job, as well as their progress with physical therapy. Even after I do clear patients to return to work following a labral repair, I always remind patients that they still may need to be careful about how they use their arm. I want my patients to work smarter, not harder. This may mean changing some of the ergonomics of their job in order to better position the arm for lifting. Positions where you are out away from your body or at awkward angles, either above your head or behind your body, can place added stress on your labrum and are to be avoided even after returning to work. Ultimately, the return to work can be seen as the final phase of rehab that will help to strengthen your shoulder and help you to gain additional confidence in the shoulder as time goes on. It is at that time that I would allow you to return to all activities without restriction. From a workers' comp standpoint, I think that it takes a minimum of 6 months following your labral repair before I would even consider that you have reached your maximum medical improvement. What this means is that you have fully recovered from the surgery and the workers' compensation company can close your file. Once you have regained all of your strength in the shoulder, I encourage patients long-term to continue with their home exercise program on a twice-a-week basis. This will help maintain the strength in the shoulder, but most importantly, will prevent a recurrent injury or recurrence of your symptoms. I hope this video has helped you to better understand the process involved as you attempt to return to work following your labral repair of the shoulder. If you have any further questions regarding return to work following labral repairs, please do not hesitate to call my office. I hope you've enjoyed this video. Have a good day.